Honestly, to expect the unexpected. We've had patients who are so sick and like you count them out, but out of nowhere, they'll just start getting better. They'll feel better, they'll be stronger, they'll start putting that work in. And then they get up and leave, and you're like, oh my goodness, I did not expect that outcome, right? You'd already put them off into like needing like a relocation or something.
Welcome to the Specialty Cafe, the podcast that helps you, medical trainees, find your perfect specialty. My name is Cameron Wong, and I'm a current fourth-year medical student at Queen's University. I'm very excited to produce this episode as a part of the R1 Prep for Residency series, where we're producing episodes with a whole different bunch of allied health professionals to help R1s refresh themselves on who's in the hospital and who can help them give patients the best care possible. I am going to be chatting with Taylor Farrance, a patient care navigator at the Kingston General Hospital, the same hospital where I did all of my medical school training. So I'm very excited to chat with her. Thanks so much, Taylor, for coming on the podcast and being with me tonight.
Yeah, thank you so much, Cameron.
Do you think you could tell us a little bit about your background as a patient care navigator and how you came into the role?
Yeah. So I went to nursing school here in Kingston. So I have a bachelor's of science in nursing. And then I kind of started my career at KGH working on the medicine unit. So when I was working the medicine unit, that's where I was kind of first introduced to this patient care navigating role. And then I did venture away from medicine for a little bit, cardiology and critical care. But this opportunity kind of presented itself. During my nursing school, I actually worked as a personal support worker in the community in people's homes, and I saw some of the barriers that were out there, these great big long wait lists. And this opportunity came up, and I thought it sounded really interesting on how we can help people get out of the hospital, because it's easy to get into the hospital, but sometimes getting out can be a bit more trickier.
Medicine focuses a lot on the starting bit, admitting people to hospital, making sure that they're like well managed and have a care plan in place. But like for sure, I remember working with Jess, who's your coworker at KGH, a lot when I was on internal medicine, and she was the master of finding places where people could be safely after they leave hospital, and all their medical issues were tied up in that aspect. And brief kind of aside, I know Jess is RN as well. Is it common for patient care navigators to have a nursing background?
Yes, I do believe there are in like the job stipulations, there is an option for like allied health, so like a physiotherapist or an occupational therapist to be in this role. But I don't think that has happened in my current facility.
That makes sense. And so for everyone listening to the podcast, do you think you could clarify, what does a patient care navigator do?
Yeah, so the patient care navigator is responsible for basically monitoring and supporting the patient's journey from admission to discharge and transitioning them into the community and what that looks like for the patient.
Yeah. And in terms of like kind of ways that people leave the hospital, I remember from my rotation in internal medicine, people could go back to the place where they originally were. It could be home. It could also be a new place for them. It could be a long-term care home. It could be a nursing home. Many different options. Is that right?
Yeah, so long-term care home and nursing home are actually like interchangeable terms. I think maybe you were making it more of like a retirement home
Yeah,
option as
that's
well.
right.
And then there's also like rehab, like inpatient rehab. There's rehab in patient's home. There's like traditional home care. There's a lot of options out there for patients.
And so, what does the actual practical process of getting to know patients and finding out where they can feel best supported after the hospital look like?
So for every new admission that comes in, so I'm assigned to like a specific internal medicine team. So I'm the care coordinator, patient care coordinator for IMUA. So with that, I follow every single patient that's admitted under that team. So whenever a patient's first admitted, I do try to do like a kind of informal assessment with them, kind of hear how things were going at home, kind of look for those red flags, right? If someone was having frequent falls, forgetting medication. I also try to do a touch base with the family as well, just to kind of see sometimes patients that are admitted into internal medicine aren't always cognitively intact to answer those questions validly.
Hmm.
And then through that, I'll make suggestions for the medical team to either consult like physiotherapy or occupational therapy if they're not already consulted. Um, and then sometimes I kind of go into the background a little bit at this point and kind of let the medical team do their piece, get the patient feeling better, and then we kind of every day we attend like a allied health rounds with like the charge nurse of the units there, the registered dietitian, physiotherapy, social work, occupational therapy, and the senior resident for the medicine team is there. And we go over every single patient on the floor and kind of if they're close to discharge, like we're thinking like, oh, maybe a couple more days, so that the allied health can make their accurate assessments and kind of prioritize those patients. And then I really rely on like our physiotherapist and occupational therapist to kind of do their piece on making their recommendations of if this patient's safe to go home, and what kind of supports they would need if they are.
What I remember from working with Jess on my internal medicine rotation, Jess is the PCN who worked with my internal medicine team.
Hmm.
She would always be like silently in the background doing exactly what you said, liaising with PT, liaising with OT, and making sure that like patients were like able to go home safely. And like it was just always that like silent support that kind of like wowed me because when it was time for a patient to go home and I started thinking like, oh, actually like what is going to happen? Jess already had like a full plan kind of ready, and it was just so comprehensive. I swear, like patient care navigators know every single LTC in the area, every single retirement home,
Hmm.
every single other like rehab stream that patients can go to. It's like it's very very important work for sure.
Yeah.
Is there a certain like case that you can think of where your job as a PCN really made things like produce the best care possible, like a case that really stands out to you?
There's the cases that always stand out to me the most are either like a palliative care discharge home, just because they are so complex and such a fragile patient, right? There's a very limited time frame for this patient population to get home and what that looks like. And they're normally going home quite far from their functional baseline. So it's really like an all hands in, like the doctors doing their piece, making sure the patient's stable, connecting them with like their family doctor or a palliative care doctor in the community. The occupational therapists are doing their assessments for equipment and kind of the supports they need. And then I feel like in the background, I'm kind of liaisoning with like Ontario Health at Home to make sure those supports are in place. Educating the family actually is a big part of this role as well, right? Educating the family on what home looks like, kind of setting that expectation of their care needs at home. So I feel like when I have like a successful palliative discharge, I always feel like I've kind of accomplished something like what a patient truly wanted. Hmm.
It must feel really satisfying to be able to like share information and clarify things for patients and their families after hospital. The healthcare system is often a new environment for a lot of patients, and when patients leave to a new place, whether that be like you said, like a palliative care discharge or like a new nursing home, a new retirement home, they're new places that are like kind of filled with like the unknown, and so I'm sure patients and their families are super invested in what you have to say and to know like what their life will look like and how they can continue to like meet their care needs there.
Hmm.
Yeah, for sure.
And I don't always have those answers for those family members too, which I think is kind of the most daunting and kind of most challenging part of my job, right? Like for example, someone who's been in like ICU for a long time, they're now bedbound care, like they're so far from their baseline. The family's like, what does discharge look like, right? And then you kind of set those expectations of like working with physiotherapy, right? They have to be making gains to be able to go to like an inpatient rehab and just having those like complex conversations about like navigating the healthcare field.
Exactly. Yeah, exactly. How do you tend to interact with medical trainees on a daily basis, whether it be residents
Mhm.
or medical students?
Yeah. So I feel like sometimes I deal a bit more with like the senior resident just because we're kind of having like the day-to-day conversations and they're more so responsible for the discharges. But I do kind of infrequently throughout the week attend like the medical rounds with like the attending and all the residents. And it's really great because sometimes, actually all the time, the med students and the residents are the ones who are assessing these patients down in emerge when they're admitted, right? So you guys are kind of that first face that they see in the hospital, and you kind of set that tone and that standard for that admission. And you get the families when they're sometimes at their worst, right? They've been in emerge for hours. They're desperate for answers, and
Mhm.
you guys kind of have that first interaction. So sometimes it's helpful to hear those conversations that you guys have with family members to fill in the gaps.
It's interesting that you say that because I've never kind of thought of how things might look from the other side. I'm very familiar with meeting patients in the emerge when they're at their most unwell and they're with their family who have been waiting for sometimes like upwards of 16 hours and they stayed up a whole night and they're seeing me and we're chatting about how like the admission will go. So yeah, interesting to hear that like that's how that things are perceived and like that those initial conversations can set the tone that way.
Definitely, yeah.
Do you feel like there's any misconceptions that people have about the role of a patient care navigator?
I think sometimes people think that kind of discharge planning happens at the end of the hospital admission, where discharge planning is actually happening like kind of throughout the admission, right? Through each interaction with the physiotherapist, the occupational therapist. So I think I'd rather people reach out to me earlier or residents reach out to me earlier if they feel like there's concerns that are not being dealt with.
Uh, Not everything can be done on the last day. It is a
Mhm.
lot of work to like coordinate patient transfer to like different places and make sure that like they're well supported there, especially if they need home care services and they need
Mhm.
or like outpatient nursing to follow up, for example, a nursing to come deliver IV drugs, a nursing to follow up on their status outside of hospital. So yeah, I think it's a lot to ask in one day. And then
Mhm.
also, I remember patient statuses changing like really frequently in hospital, which also changes what is available for them when they can be discharged. So like very dynamic for sure.
Definitely, sometimes I'll submit like they're going home tomorrow and I'll submit the home care referral and then they don't end up going, which is just it's just the acuity of the hospital, right? So I feel like our community partners are very understanding of that and we're fortunate to have that relationship with them.
That's very good. Good to hear, definitely, because things change a lot in the hospital, for sure. And related to the question of misconceptions, would you be able to clarify like the difference between a patient care navigator and some of the other allied healthcare professionals? For
Yeah.
example, like social work would be one of them.
Yeah. So I think back when I was a bedside nurse, I definitely think I even have had gaps in my knowledge of what each individual does. And I feel like based off kind of which facility you're at, it might be different, right? Sometimes if the facilities don't have a patient care navigator like myself, that social worker or the physiotherapist, the occupational therapist might take on more of that role. So I'm speaking more so to kind of at like KGH and kind of what's been my experience. Um, a social worker helps kind of the individuals and the families with addressing like social and like emotional or like behavioral issues. So they will like assess their needs, develop support plans. Some social workers even provide counseling,
Mm.
and they do connect the clients with like the resources to improve like their well-being and quality of life. So whether that's like a mental health like, referral in the community, um, kind of helping with like relocation, where I feel like patient care navigators, we kind of have that like nursing background and knowledge. We look more at it like from a medical side of discharge,
Mhm.
right? So, do they have the IV antibiotics? Is there wound care that needs to be followed up? And kind of, I think more so what like their comorbidities and how that can affect their discharge.
Yeah, is the place where they're going appropriate for the level of
Hmm.
medical care that they need? Like, for example, a patient with really, really high care needs might not be appropriate for a retirement home.
Yeah, yeah, definitely. And I think so the physiotherapist, whenever they see someone, they're looking at can this patient ambulate? How do they mobilize? And if they need like a gait aid, like a walker, where the occupational therapist, they assess more like their activities of daily living, bathing, dressing. Can the patient do that? And if so, maybe finding like more adaptive things and like the instrumental activities of daily living. How do they cook? how do they
Mhm.
clean? And they also do like a cognition component as well, right? So they are able to complete like a MOCA, and they also do like home safety assessments. So
Mm.
that was definitely a big learning curve for me, is what a physiotherapist does and what an occupational therapist does.
So many different people in the hospital, and like so many different roles that I learned across like my entire clerkship.
Hmm.
And like really I was like amazed at how much people how much could be done for patients and how much expertise there was in the hospital. I remember as like a medical student, like just kind of envisioning the role of a doctor, and I hadn't had a lot of like formal medicine exposure before then, but I really thought like the doctors were the only ones who did it, like it were, or the people who had to do everything, and like supported by nursing, not really knowing any other people in the hospital. And now I know that like really you have so much expertise in like knowing how patients can be best supported like on discharge, like from a medical standpoint. There's social work with more of the cognitive and behavioral standpoints. So many like experts really
Hmm.
from like an incoming resident perspective, like speaking for myself and on behalf of other incoming residents as of July, what are some ways that you think like people on the medical team can focus most effectively on like making sure patients have like a safe and effective discharge?
Yeah. So to me, a safe and good discharge is all about having like the family and the patient on the same page and committed to the plan. Through kind of that early discussion we talked about, right? Setting that expectation, setting those goals, and being realistic with the patients and families about their abilities at home and kind of the supports in the community. Because if you really don't have them on board, I don't think it's going to be as a successful and safe discharge as you would hope for.
Yeah, that makes
Yeah.
sense. I remember like especially when like a patient's family was really involved in their care. They were at the bedside. They were always asking questions. It made it a lot easier for me to like also communicate like what I thought was going on, and also what, for example, if a patient was going to rehab, what that might look like and
Mhm.
how they can best be supported. And for sure, I could just like I felt secure like deep down about having a patient go off to rehab, because I knew the family was so involved in their care and like really open to what I had to say, what Jess, the other PCN, had to say. So I definitely get what you mean with regards to
Mhm.
that. And what are some cool lessons that patients have taught you in all your experience as a patient care navigator, having like talked through patients and followed them from admission to discharge? I'm really interested to know.
Honestly, to expect the unexpected. We've had patients who are so sick and like you count them out, but out of nowhere they'll just start getting better. They'll feel better. They'll be stronger. They'll start putting that work in, and then they get up and leave, and you're like, oh my goodness, I did not expect that outcome. Right? You'd already put them off into like needing like a relocation or something. Um, and definitely those ones are the ones you feel like you're like, yeah, people are
Yeah,
good. People are getting
go.
stronger. People are getting better.
Yeah, yeah, that's really encouraging to hear and see for sure. I've always thought that like yes, like there's a lot of learning in the hospital, especially as a medical student, like a lot of like seniors to learn from, people up like the totem pole of medicine, but also like patients are like really great teachers as well, not in just like what they have to say, especially more elderly people like with like lived experience, but then also in seeing like what they can do in the situations where they're in. A lot of like patients are dealt like a pretty bad hand health wise, but like can make like in really significant gains, like you said, that just like astound you.
Mhm.
Yeah, very inspiring for sure. And like kind of on like the theme of this in rounding out the podcast episode, what are some key pieces of advice you'd have for like practical pieces of advice you'd have for new residents in caring for patients and making sure that like you have things like figured out for them?
Communication is so key. I feel like that's like what a lot of my job is communicating, whether that's with patients or families. And like reaching out, something as so as simple as like whenever you're assessing your patient, after you're done assessing them or before you do, touch base with their bedside nurse, get that kind of inside view onto what's actually going on with that patient that day. And also, like, don't be scared to reach out to your allied health on the units, right? They normally do on the units kind of display if there's like a certain physiotherapist to that unit, and reach out to them if you find those are the ones who are kind of assessing the patient every day. Versus like putting in a new consult, like just like reach out to them, pick up the phone,
Mm-hmm.
is sometimes the best way just to communicate with people, right? We all have the same goal of giving the best care to the patient and the best outcome.
Exactly. Yeah. That like kind of coincides again with my like, experience of like being in the hospital, just realizing that I can only spend like a finite amount of time with like my patients before I have like other responsibilities, but like at all other points of the day essentially there's someone else seeing the patient and like evaluating a different side of things. For PT it's mobility, for OT it's cognition and like the supports that they might have like at home, like for from an assistive devices lens. And so like really I think I've learned to like rely on like the expertise of people in the hospital, and I think that's
Mhm.
what really drew me to apply to internal medicine and like things that make me stay is that I get to work with like really passionate people like you and others who, like you said, are dedicated to making sure a patient gets really excellent care.
It
Truly.
makes me so happy whenever someone wants to go into internal medicine, right? Because it can sometimes be really daunting. Like you are dealing with multiple comorbidities, like sometimes like the sickest patients in the hospital, really. And you guys just bring such an energy to it, and I appreciate you so much because that's what we need in it.
I hope that I can bring it to the table when I start in July. Yeah. Well, thank you so much, Taylor, for chatting with me about the patient care navigator role. Really, really an important profession, especially in like the ever-growing complexity of
Mhm.
patients and the ever-growing complexity of the medical system. You guys are truly the experts on making sure patients feel safe when they leave the hospital.
Perfect. Thank you so much for having me.
I'm really glad I got the chance to chat with Taylor Farrance, one of the patient care navigators at the Kingston General Hospital, and as I just mentioned, one of the experts in making sure patients can leave the hospital safe and effectively. If you weren't aware of what a patient care navigator was before listening to this episode, I hope you learned something or two from Taylor, who had a lot of excellent advice to share. And if you did already know, and you are an incoming resident like myself, then make sure to not hesitate to contact them in hospital and liaise often with them. Communication is always valued from them, as Taylor mentioned. Thanks so much for watching again. If you're a resident, a part of a Royal College affiliated specialty, remember to join as a resident affiliate member for no cost and lots of benefits. This is Cameron Wong with the Specialty Cafe. We'll see you on the next episode. Thanks so much.